Okay, now for our last speaker for this afternoon. He studied holistic dentistry at a private university in Witten, Germany. He is a practicing holistic dentist with focus on environmental medicine, a lecturer and author, and a developer of nutraceuticals. Moreover, he is an advisor of the Medical Society for Comprehensive Biological Therapies, and he is the head of the anti-aging and preventive medicine department of several private clinics in Germany and UAE. He founded and the medical and scientific director of the Institute for Integrative and Preventive Medicine, IIPM, in Germany, for the support of the detoxifying treatments in all chronically diseased patients. He has published more than 80 papers, scientific articles, and contributions to books in the last 9 years. Without further ado, let us welcome Dr. Hans-Jörg Lammers, or is it Hans-Jörg Lammers?
Right, thank you. Good afternoon. Thank you so much for the introduction, and thank you to the committee of the conference for inviting me. Now, in the last 29 years, I'm practicing biological dentistry without any metals for human mouth. And I will give you a short inside look why we are doing so, and I hope to enlighten a very dark part of human bodies called oral cavity for today. And you will see what we do in our clinical practice every day. So I am trained in the 90s in functional medicine and environmental medicine. And what we do is unique in Germany because I have the only clinic in Germany which is totally metal-free. So to understand right, we never put metals in mouths. And I will explain more in detail now why we act so. So look here to that study which showed that heavy metal detoxification has been a decrease in cancer mortality by 90% over a period of 18 years. And metal detoxification has shown a very strong correlation between cardiomyopathy, that means heart disease, and heavy metals accumulation. And that is very, very paramount to see. In all chronic diseases, and it doesn't matter if it is migraine, fibromyalgia, or arthritis, or rheumatoid arthritis, or even cancer, all patients have an upload in heavy metals. And that is a really big point to know, because heavy metals disrupt everything. They disrupt the respiratory chain in the mitochondria. They block all hormonal receptors. So it is quite important to get rid of all these metals in your own mouth at first. So look in your own mouth at first. Do you have metals in your mouth? Do you have amalgam fillings? Then listen very carefully now. Because health starts in the oral cavity. And you see here on this slide that more than 80% of that mercury vapor comes directly out of amalgam filling. That's why we never did amalgam fillings. It is one of the worst things in the world. So whenever you find in your own mouth amalgam fillings, go to see your dentist straight away. And now listen, it is important to take attention to the vapor, because we never remove amalgams without mercury protection. You have to protect the body against the mercury vapor. And 20% of the mercury goes directly through the root into your body and is converted by the gut bacteria. And then it is possible to go through the blood and lymph directly into the brain and make these terrible diseases like Parkinson's or Alzheimer's. So there is no doubt that you see here that mercury promotes Alzheimer's disease. And it is a culprit in almost all chronic diseases. Let's say high blood pressure, let's say asthma. Wherever a disease is called, you will find an overload of heavy metals. So keep this in mind. In 2001, I published in the German paper for environmental medicine another culprit. And this one was called the supertoxin mercury and bacterial toxins from root canals. And this is another very, very important point I have to stress. Never forget in your chronic disease patients, extreme in cancer patients, that you have to extract all root canals. Because when you leave root canals in your body, according to traditional Chinese medicine, all teeth are strongly connected with inner organs. And they block the inner healing. They block the immune system. They block the proper reaction of the immune system. So don't forget to extract root canals. Because a fact which no textbook will show is that the tooth anatomy does not conform to the textbook examples, because in textbooks you only find main channels. But what we have here is the many lateral and accessory canals in addition to the main channel. And this is very important because the lateral canals here in the yellow dentinum are kilometers long. So you have heard right. Every tooth, here a lower molar with 2 roots, every root has more than 2 to 3 kilometers of side channels. So no dentist in the world is able to clean up these very tiny, microscopic small channels. No root disinfection, no root filling is able to disinfect a channel like this. Never laser can do this. This is a new propaganda in Europe. They tell the patients, come to see me for an endodontic laser treatment. My God, it's money making, not more. Don't forget laser treatments for disinfection or sterilization of root canals. That isn't possible. So here you see the difference between a vital tooth, no bacterial, but here a non-vital root canal, it is invaded by fungus and bacterials. No matter when you are chronically diseased, get quickly rid of such teeth. And the studies which are published are going back to the 20s of the last century. So the knowledge is more than 80 years old that nobody can sterilize, especially dentists, root canals. Okay? And most of those studies came from Japan. Interesting. So that's why we prefer metal-free dentures. And this is a case from our clinic where I will show you what we do after extraction. You can do a metal-free bridge, you can do a plastic prothesis, or you can do metal-free implants. And this is a case where a client chooses the implants. And we never did titanium implants because I learned in the 19s that titanium corrodes so much. I will show you slides from the publications and from the international research which will underline what you hear now. But what we do is we use metal-free 100% zirconium dioxide. And the raw material comes often from Thailand. But it comes in nature with radioactive nuclides. So it has to be refined and cleaned very much in order that it is not influenced with radioactive byproducts. So let's see what we do. We do on this, you saw it here, on this metal-free implants, we do zirconium crowns. And you never can find what is artificial and what is made by nature. That is what we want. We want a mimicry of nature and not seeing the borders of metal crowns. So the question is, do we need implants? And when you see a regular case, what we often have in our practice daily, you have one root canal after another. So this client has a multiple metal situation. And the more metals you find in a mouth, the more corrosion will occur. Don't forget, the very good gold will pull the very bad metals out. So let's show you another case. Here you see a titanium implant. This was a titanium implant with a metal crown. You see it directly what is underneath. You see it because of the corrosion of the titanium implant, especially of the abutment, that here is something artificial. Then another dentist changed the metal crown to a ceramic crown. Now it looks a little better, you know, a little better, but not much. And then what we did, we changed the abutment from titanium to zirconium and the crown as well to zirconium dioxide. And now what you see is the new situation. Now you can't differentiate what is nature and what is artificial. So you need a stop of corrosion. That's why the always moist oral cavity lets everything goes into corrosion. So whenever you put metals in your mouth, it will corrode. Don't forget this. So let's see what an implant is. An implant is normally a metal part with an abutment cord and an artificial crown. So what we do is this root part is made of zirconium dioxide, the abutment is made of zirconium dioxide, and the crown is metal-free as well. So the publications are multiple. You find hundreds of publications about corrosion of titanium. Whenever a dentist says titanium will never corrode, is a liar. Titanium corrodes as all metals do. So we discuss a malintoxication through titanium, local accumulation of titanium nearby implants in your lymph nodes. So when you get titanium implants in the next 6 months, you will find titanium particles in all of your lymph nodes. And here is the study. It is from 1994. So a lot of scientists show that there exists a galvanism, especially when you have mixed alloys in your mouth. You have amalgam fillings, you have gold crowns, and you have non-precious materials in your mouth through protheses or other crowns or bridges or inlays. So you can mix so many up. It's unbelievable what we can find in human mouth. So what we do, and what is called the newest generation in implantation, is here shown. It is a zirconium dioxide one part implant. We have one part implants. I show you the case before with the 3 crowns. And we have 2-part implants without abutments. So these implants had a root design, is a copy of the apex, and the ideal shape is created by university studies. So in Germany we have 26 German universities, and nowadays all universities uses metal-free implants. So you have a lot of advantages when you use metal-free constructions. A big advantage is the quantity of plaque measured on the surface of composites, titanium, and zircon. So the zirconium surface is the best. It is better than the own surface of your animal because the quantity of plaque is so less. So you see the case after 2 years again. Here we had the implants, here the single crowns. After 2 years, it looks beautiful. And here you see a bigger case. Here you see again the 3 ones from the upper right side. No, yes, this is the upper right side, is the different, yes. And here you see how the gingiva looks like. You will never find this with metals because this is another advantage of zirconium dioxide. It has free oxygen groups in its surface, and tissue loves it. Tissue crawls up to the implant, and this never will do metals. There is no inflammation because there is no corrosion. Here you see another case. We have 3 implants on the right and 2 on the left. Here we had single crowns. Here we made a bridge. And now you see it is paramount to detoxify clients, and that is my daily work. So most of my clients are chronically diseased, and they come to see me and ask me, "Doctor, please help me to get rid of my heavy metal upload." And first of all, what we check is the genetically capacity to detoxify heavy metal through the liver. And that is what we check now over 20 years. I brought this knowledge at the beginning of the 19th from my studies at the environmental clinic in Dallas. They did this in order to see how quick we can detoxify a human being. But when we do it too quick, when we do it too aggressive, we often see side effects. And these side effects are often a progression in symptoms. And in order to avoid more and stronger symptoms, we first check the genetically outcome for the detoxification capacity. We check the GST, the glutathione S-transferase gene. And the most important gene is the M1 gene. M1. The GST-M1 is paramount because this gene is responsible for detoxifying the brain. And remember, all chronic neurological diseases have an upload of mercury, arsenic, lead in the brain, in the central nervous tissue. So we check the detoxification capacity, and this guy was a rapid detoxifier. He came to see me with a whole body eczema. This whole body eczema was wet, it was itching, and the guy was not able to wear normal clothes. We looked in his mouth. And I will tell you, the reason why he get uploaded was not the amalgam, but the amalgam fillings were the solution for downloading his body. He loaded himself up by cleaning his plastic, it was a part in his apartment. He cleaned a plastic carpet, yeah, with a mechanical device and produced plastic vapor. And he doesn't use any breast protection, any masks. So that was the real cause for his eczema. But you have to keep in mind what is the simplest way to download toxins. It is to chelate heavy metals. You have to drain the patient, and it doesn't matter what way you use. We are all very uploaded with heavy metals because we breathe, we eat, and we drink water. And all these three things are not clean enough for our bodies. And you know, what we did was we removed under mercury vapor protection, his 12 amalgams. He had 12 amalgams. I by myself had 8 amalgams. I got the amalgams in 1970 by my local dentist. And the first thing what we did as I studied and as I started to study was we cleaned our mouths first. That was the first thing what we did as students. We removed our amalgam fillings. So it is well known in the dental society that amalgams are not a good tool for longevity. So what we did here was we protected the guy against mercury vapor, and we removed one after another. And after this, we chelated the heavy metals. And look here. He came to see me in this situation. This situation was over 2 years. And after my removal and my chelation, he had baby skin. That is what we want. We want effects. That is positive effects. And a rapid detoxifier, what do you think? How many weeks does it take from this situation to that situation? How many weeks does it take to chelate him? When you have a rapid detoxification, what do you think? How many weeks? Do you think 4 weeks or 20 weeks? What do you think? What is a human being able to produce? In this case, and this is the normal range, it was 16 weeks, 4 months. After 4 months of continuous chelation, and we did a combination of disodium EDTA IV and disodium calcium EDTA orally in an encapsulated liposomal solution, we received that. I will show you later what we took. This is another case of a slow detoxifier. This woman came to see me and said, "Doctor, when you have no solution, I go to suicide. My eczema is so strong, it feels like fire in my face. It's burning, it's hot." And believe me, it was terrible for that woman. It was only her neck and her face. It was burning like fire. And we did the same. We looked into the mouth, we found 2 amalgams, 2 root canals. And after 6 months of continuous detoxification, everything was gone. That is what you have to keep in mind. Heavy metals are total disruptors. They disrupt everything in human metabolism. They disrupt the immune system, the hormonal pathways, everything. So you have to keep in consideration whatever program you run. Don't forget the heavy metals. Don't forget to make the mouth free of metals and free of root canals. So here we summarize again. Heavy metal accumulation can cause suppression of the immune system, bind to receptor sites, inhibit proper enzyme systems, especially the respiratory chain in the mitochondria, and lead to undesirable free radicals and oxidative stress. Don't forget this. So this is me as a student in the 90s. That was where I learned this by Professor William Ray. He died last year. And this was in the Environmental Health Center in Dallas. So, what did we use? What is our protocol? Our protocol is most of the times a disodium EDTA solution. We gave it with magnesium as magnesium EDTA per IV as a drip, or we gave it as an oral detoxification as a liposomal solution in microencapsulated phospholipids. So let's see, what is a liposomal solution and what is a liposome? So a liposome is structured made of a phospholipid. And this phospholipid is simply called lecithin. Have you heard of lecithin? Of course. And here you see the structure. You have an hydrophilic head and you have an hydrophobic tail. The phospholipids mimics the B layers of every skin and cell. So, this is not a new technology, believe me. You find studies for drug compounding back to the 70s. But for what we do, it is really new because it's based on the idea of integrating the world of vitamins in a biomedical science most advanced nutritional delivery system. And that's called liposomal solution. It is so convenient. My clients love to take liposomal solutions because you have a small dosage and you have a big effect. So let's see what liposomals are. Liposomes, a drug delivery system, and discovered in the early 60s. And structurally, liposomes are concentric bilayered vesicles, and it is a mimicry of the bilayer of every cell. So, when you put a nutrient in the center of a liposome, you can carry it and transport it in every part of a human body. For example, there exist on the market liposomes with everything you can imagine. You can put B2, a glutathione, B12, vitamin C. You can put nearly everything in liposomes. And it is really easy to administer. You put the solution in your favorite drink. You can take the normal still water, or you can take a juice if you want, and then you can drink your liposomal supplement. And the solution will go inside the cell because of the similarity of the structures. So, liposomes get the nutrients in. They have increased bioavailability. They have a higher response and the reduce of side effects and an improved user convenience. So it is a transport of blocked compounds, for example, across the blood-brain barrier and into brain structures. So liposomes is one of my favorites. The advantage is a sustained blood level with greater bioeffectiveness. We minimize loss of activity. It is a kind of stealth technology, and it is an improved protection against breakdown, early breakdown, and it has an increased circulatory half-life. So, when I spoke from encapsulated EDTA, we use a calcium disodium EDTA. And the functions of calcium disodium EDTA are extreme. It lowers the total cholesterol. It lowers the triglycerides. It lowers the bad cholesterol. And it lowers, besides vitamin C, it lowers LPA. Lipoprotein little a. And it's soluble fibrin, and for me, it chelates toxic heavy metals from body and brain. And it is a reactive platelet aggregation lowerer. So you have so many advantages when you use liposomal EDTA. So the study results confirmed substantial excretion of heavy metals. A surprising outcome of the study was the remarkable clinical healing and increase in brain acuity. So to catch the heavy metals from the brain is very important in neurological diseases. So heavy metal accumulation linked to increased free radicals, to reactive oxygen species. It can contribute to pre-major aging and aging diseases, and can cause suppression and deregulation of the immune system, and leading to a 10-fold increase in cancer mortality. So don't forget the T's. Whenever you see from next Monday onwards a chronically diseased client, Look into his mouth. When you see metals, and you don't have to study dentistry to identify metals, send him to a biological dentist. So heavy metal accumulation is suspected to contribute to learning disorders. So I have a lot of autistic childs in my clientele, and increases the risk of cardiomyopathy. So in the Journal of Advancement in Medicine, a death from arteriosclerosis was reduced by chelating of metals. And it is a possible pathogenic in all cardiovascular diseases. So the result was a large increase, more than 10,000 times for mercury and antimony. Unbelievable. When you chelate. So free radicals and oxidation processes are strongly connected to a heavy metal burden. So when you chelate heavy metals, you lower the oxidative stress phenomena. So people always ask me, what are you taking against oxidative stress? And my daily regimen is this. As I started with vitamin C, it was in 1991, I was used to 8 grams vitamin C. So nothing happened, no diarrhea occurred with me, with 8 grams. Make this test by yourself. Take every 2 hours 1 gram of vitamin C up to your bowel tolerance. And you will realize how high is your use of vitamin C. Now I take 600 milligrams per day, or 1 gram in a liposomal solution. That is enough for me, because I use it nearly 30 years every day. So I take mixed carotenoids, I take mixed tocopherols from palm trees, I take zinc, selenium, OPC, CoQ10, carnitine, and omega-3 fatty acids. So, pre-major aging, systemic heavy metal, and vascular decalcification treatments can lead to anti-aging processes. Decalcification. I heard so interesting things about this SAC calcium that I can tell you that is my new project for the year. Okay, learning disorders and neurodegenerative diseases. Heavy metals, particularly aluminum and mercury, can bind and accumulate in brain tissue. There is no doubt all these little childs who suffer from autistic syndromes are filled up with aluminum and mercury. And do you know the source of mercury and aluminum? Vaccination. Don't forget this. Vaccination. There exists no vaccination in the world which is free of mercury. No. So, it affects proper brain functions, has been found in high concentrations in all neurological diseases, including dementia, and enhance the risk of autism. So this is one of my favorite slides, because what you see in the mouse is 10 to 20%, but what is inside is 80 to 90%. Don't forget this. So here are my references where all my slides are. There are hundreds of references, believe me, that heavy metals are the main culprit in all chronic diseases. And it doesn't matter how the disease is called. It starts with allergies and goes to cancer. Don't forget, all clients are uploaded with mercury, arsenic, cadmium, nickel, and lead. Don't forget this. So, here you see where I'm located. I'm located around 240 kilometers north of Frankfurt. The city is called Düsseldorf. I'm in the city center. When you want to come into contact with me, use my personal email address, and I will definitely answer when I'm not abroad on lecture tour. So, this is the River Rhine and the old town of Düsseldorf in comparison where we are. So thank you so much for giving me your time. Thank you.
Thank you so much, Dr. Lammers. Any questions for Dr. Lammers? He has been so gracious in keeping his time. So now we can give him a few minutes for his questions.
Yes. How would you know when you do the chelation, the heavy metals are not just being remobilized to other parts of the body rather than being excreted?
Very good question. Because the thing is, you can only get rid of the heavy metals by mobilizing. So when you don't mobilize, you can't get rid of it. So that is a second problem what you have to learn when you do chelation. How do you protect the body against the second wave of heavy metals? And believe me, in the last 30 years, we did an enormous number of chelations. And you have to know, we do around 50 chelations every day. So we know how to protect our clients, yeah? And one of the most advanced tools is zeolite. Yeah, zeolite is one of the best protections besides selenium. Yeah, zeolite is one of the best protections to give it in powder form or give it with bicarbonate, because zeolite has an aluminum problem. Don't forget this. Yeah, that's why you have to give zeolite in an alkaline solution. Yeah, to hold this aluminum, or give it as a spray. We have nanoparticle sprays available with zeolite, really nice products to avoid these kind of side effects. Yeah.
Doctor, do you have any information about patients who might have titanium or other metals in joints replacements?
It's the same problem. Wherever you put titanium in, it will corrode. And when you ask an orthopedic surgeon, they knows it better than me. Because in Germany, every 7 years, they explant the hips or the knees or whatever because of corrosion, yeah? And that's why most of the advanced surgeons in orthopedic surgery go to zirconium as well.
So if a patient has screws or plates and they say, oh, doc, I'm supposed to get these things out after a certain time,
right,
you should tell them, get them out. Yeah?
Yes,
yeah.
Of course, get them out.
Thank you.
Okay.
Okay,
Good.
thank you. Okay, okay, we have one more question.
I have one question. Regarding the implant, you say that zirconium oxide is actually good. Is there any other substitute besides the zirconium? And is there any
You mean for dental implants?
Dental.
Yeah.
Yeah, it is the best alternative material we have. You can use non-precious metals as well besides titanium, but you have the same problem as side effects, the corrosion. Whenever you put metals in bones or organs or wherever in human bodies, it will corrode. Don't forget.
Is there any study for long-term after using this zirconium
Of course,
implant?
of course. It was in
There
my
are safety?
references. We have studies now for over 25 years. The first zirconium implant was inserted in 1972 in Germany.
Right.
So it's a long run.
Okay, thank you.
Okay.
I have one question. I just want to ask, how about the people who used to put gold in the teeth? Any effect of gold?
Conventional dentist does
yeah.
this.
The gold caps.
You know, gold is not gold by itself. It is an alloy. When it would be pure gold, there would be no problem because saliva isn't able, to ionize pure gold. But pure gold is too soft to bite. That's why you have to strengthen it as an alloy. And you have normally 7 different heavy metals in one alloy. And that's why every gold inlay corrodes, because it has palladium, it has manganese, it has copper, and so on. So when we change metals, we never change amalgam into gold. That's totally wrong. You have to change into ceramic inlays. And not, or into composite inlays, We have composites which are free of free molecules. These are high-priced materials, that's true, but in comparison to gold, zirconium inlays are not higher in price. Good.
Okay.
All right.
Another questions regarding, hello, can I ask a question?
Okay. Maybe
Okay.
we'll ask-
Before your
because,
question, can we just inform those who want the book signing from Professor Longo? He is in the VIP room.
He's waiting in VIP room now. Okay.
Okay, go ahead for your question.
Is there any problem in terms of biological dentistry? This wisdom tooth will give any problem if you don't extract out? What's your opinion?
What is the problem in again?
Wisdom tooth.
Wisdom tooth.
If-
When we put zirconium in it, is there any problem with the tooth?
If the wisdom tooth is inside, is it give any problem in long term?
So
Let's say
if
we
it
keep the
has,
wisdom
if it's an impacted wisdom tooth, is
No,
that what you're saying?
your
Yeah.
question was any problems with wisdom teeth?
Yes.
If
When
it is
when it is
impacted,
in the bone,
it's
Yeah.
yes.
when it is not coming out.
Yeah.
It could be a problem, when there is a connection, with the periodontal ligament from the prelast tooth. Then bacterials can go to the not coming out tooth. Then it is a problem. But you have 3D X-rays for this. And you see if there is a cyst around or something like this, then you have to extract.
All right. So
Yeah,
we
but
have
you
to do the
you need 3D cone beam. Yeah?
All right.
Okay,
Okay.
good.
Okay,
Thank you so
Okay,
much.
that's all.
that's wonderful. Okay, can we now ask Dr. Mazia and Dr. Homer Lim for the token of appreciation?
Oh, my- Thank you. Thank you. Thank you so much.
Okay, thank you very much to our speakers and to our delegates for staying up this late.